Well, good morning. Good morning. Good morning. Welcome to Health Check, where you can stop, take a minute, and check in on you. Health Check, as you know, is sponsored by Kingdom Health Connections, which is a health promotional resource center where it's all about cultivating a culture of health, wellness, and healing for you and the entire family. So that's right. You can tune in, your family can tune in, share it with your family members. Share this broadcast with your friends as well. Like, share. Let's get the information, the accountability, the education, the health promotional resources out there because we want to prosper. We want to be in good health, and that includes you and your entire family. So we want this to be a way of living for our entire family. As you might have seen on the description, the month of October is usually set aside for breast cancer awareness. But here on Kingdom Health Connections, Health Check, it's all about cultivating a culture of health, wellness, and healing. So what I will be speaking about today is some breast health tips. So ways in which you can keep your breast tissue in good health. So this applies to not only women, but also men as well. That's right, men, you as well. This applies to you as well. You are not left out of the bunch. So tune in, women as well as men. Share it with family members too as well. Today's topic, I really wanted to focus on, if you've been tuning in throughout the past 2 years with Health Check, sponsored by Kingdom Health Connections, you've heard me talk about mammograms. You've heard me talk about signs and symptoms of breast cancer and being able to recognize when something is off with your breast tissue. Well, this month, I really want to focus on things that I commonly see in a primary care setting, some concerns, some complaints, even some worries that I tend to see in the primary care setting. I just want to address those things and help reassure you and bring some settlement and bring some peace where these things are concerned. So today I really want to talk about the topic of breast pain. Breast pain. Now, I just want to reassure you that breast pain is something that I commonly see in a primary care setting, even as I was reviewing some of the literature by the American Family Physician Association, and I was reviewing some information. It is one of the most common breast complaints that are seen by women in a primary care setting. So if there's a reason why someone's going to come to the office, your primary care provider, maybe even your specialist, it's because of breast pain. That's one of the most common reasons why women show up to their primary care provider as it relates to their breast tissue. It's breast pain. But I just want to reassure you, women, maybe even you're a man and you've presented with breast pain, maybe you have a family history of breast cancer in the family. I want to reassure you that standalone breast pain is not correlated most commonly with malignancies. So we know breast cancer. So breast pain by itself with no other symptoms is commonly not associated with any form of malignancy. It could be something happening with the breast tissue, but Majority of the times, it is not correlated with something that is malignant. So inhale, exhale. So because you may be experiencing breast pain, maybe you've experienced it for a short period of time, and it's one of the alarming symptoms. We feel it, we get alarmed because we think the worst thing. We think that it could be cancer, it could be something that's really off. But I want to share with you some common reasons why breast pain can be present. So breast pain can be present, especially in women, with hormonal fluctuations. So it is very common for breast pain, tenderness to be present in women 5 to 7 days prior to your menstrual cycle. That's because there's an increase in estrogen, there's an increase in progesterone, there's some hormonal shifts that are about to take place, especially if if you have not conceived. So that hormonal shift where there's an increase in estrogen and progesterone levels can cause the breast tissue to actually swell and cause some tenderness in the breast. So if you're experiencing breast pain, tenderness 5 to 7 days prior to your menstrual cycle, that is more than likely why you're experiencing that. If you're postmenopausal, if you're going through that perimenopausal phase, you can also experience breast pain or breast tenderness, but it's less common when you're perimenopausal or postmenopausal because of the hormonal changes that have already taken place. But you can still experience breast pain. And there's some things that can help with that during your perimenopausal and menopausal phase. Vitamin B6 helps with breast tenderness, especially in that postmenopausal, perimenopausal phase. Perimenopausal phase is that phase when you're not quite menopausal, you haven't gone 12 months without your menstrual cycle, but you may have your menstrual cycle every 3 to 5 months, and it shows up sporadically 1 or 2 days. So that's considered that perimenopausal phase. You're not yet menopausal, but you could be experiencing some breast tenderness. Vitamin B6 helps with that, as well as vitamin E. Those two vitamins too are very helpful in the postmenopausal, with postmenopausal symptoms as well. So just keep that in mind. So hormonal fluctuations can cause some breast tenderness, some breast pain. So keep this in mind. Breast injury can be another cause of some breast pain and breast tenderness. So if you've injured your breast, you've had direct contact, there's some form of trauma, even if you've had breast surgery, maybe you had a cyst removed from the breast tissue, perhaps you might have even had a mastectomy or of some sort, some type of breast surgery that can cause some damage to the nerve tissue, and that can cause breast pain. So that can be a cause of breast tenderness too as well. So keep that in mind. It may not even be the breast tissue at all. It may be the breast, the chest wall. So the muscles in between the ribs could be hurting. Maybe you have a muscle spasm in the chest wall because you did some heavy weights. That could be a cause of the breast tenderness you're feeling. Just because it's in the chest wall and that's within the region of the breast tissue doesn't necessarily mean that it's your breast tissue. So that can be another reason for it. An unsupportive bra can also be a cause of breast pain or breast tenderness. I would say more correlated with breast pain. Why? Because the ligaments, there's wear and tear on the ligaments, especially attached to the chest wall because of an unsupportive bra. And commonly you'll see this complaint with breast pain at the end of the day after exercise. So maybe you've been active, or maybe you decided to exercise and you didn't have a well-supported bra, and you exercise. You're causing some wear and tear on the ligaments of the chest wall, and that can actually cause some breast pain as well. So there's a lot of things that you can do. You want to pay attention when you have breast pain. Pay attention to what could be causing it. Were you exercising? Did you do something strenuous? Is it actually your breast tissue, or is it the chest wall? Where is it located? Pay attention. How long has it been there? Is it getting worse? Is it right before your menstrual cycle? Those are things that you want to pay attention to. Other things you can do It's also been shown, I mentioned the vitamin B6 and the vitamin E as well is helpful for breast pain, but also keeping in mind that caffeine, it's a vasoconstrictor, causes vasoconstriction to the vessels that feed the breast tissue, so your blood vessels that feed the breast tissue, and it can increase breast tenderness. It increases breast tenderness and increases breast pain. So you might need to slow down on the caffeine a little bit. Increasing the fat consumption in your food too as well can cause increased breast tenderness and pain as well. So keeping those things in mind. Smoking can also increase the likelihood of breast pain, breast tenderness. So there's a lot that you can do if you're experiencing breast pain. You can wear a supportive bra. You can quit smoking, begin that process of no longer smoking. And this is nicotine. You can begin the process of taking some multivitamins, vitamin B6, vitamin E. This is just health information. I do want to put that disclaimer there. This is not, you always want to consult with your primary care provider, your specialist, work this out, become aware of how your body composition is and what your body composition is before you start taking any form of vitamins or minerals. Because if you're on something already, it can interact negatively with what you're taking. So this is health information. I'm not prescribing. I'm not putting it out there that you should take it. But this is what studies has shown to be helpful with breast pain. But a lot of the times, if we get back to the root, we can deal with the fruit. The breast pain is just a fruit of whatever the root cause may be. It could be an unsupportive bra. It could be just your premenstrual, what's happening right before your menstrual cycle. So it can also be medication side effects. I forgot about that. So there's tons of medications that can cause breast pain, but something that may be a little bit more common because it's used with high blood pressure, diuretics. So hydrochlorothiazide, chlorthalidone, those are some names of torsemide. Those are some names of diuretics, and they can actually cause breast pain too as well. Just some side effects that can correlate with it. So we've got this information. We know the information. Let's not respond in fear. Just know that if you have standalone breast pain, it doesn't mean that it's something malignant. It does not mean that you've got breast cancer. Keep this in mind. There could be some other causes to the breast pain. So let's make sure that our breast tissue remains in good health. We have the choice today between life and death, blessings and curses. I call on all of heaven to witness the decisions that you and I make today. Oh, that we would choose life, so that not only we would live, but our descendants would live as well. That's our children's children and children's children. We want to pass this on, make sure that we're just keeping up with our physical health. Here on Health Check, this is a minute for you to stop, check in on you, do your self-awareness check as it relates to your health, because your health is important. Your health is your wealth. Our health is our wealth. So I pray that you are blessed. If so, go ahead and put hashtag I choose life. Say how you're going to choose life today. Just being more aware, being more conscientious of what's been going on. If you have any questions, feel free to put them here on the chat. You can also email me on kingdomhealthtah@gmail.com. I do go back. I do look at the responses throughout the day to ensure that we keep this community of health, wellness, and healing going, because this is our inheritance, and this is our portion as kingdom citizens in the kingdom of our Lord and Savior, Jesus Christ. I pray that you are blessed today. As always, I'll see you here again on Health Check, sponsored by Kingdom Health Connections. I'm your host, Dr. Vanessa Bolling. I'll see you here again, 9 a.m. next week, Tuesday. Be blessed. Bye-bye.